Hi, I'm Dr. Amy Bend, and I wanted to talk about ADD and the proper nutrition for you if you're trying to reduce and improve your ADD. ADD is attention deficit disorder. And so what I suggest for my patients who are suffering from ADD, or you have children with ADD, or you're an adult with ADD, you can change your diet and get adjustments and then do very specific exercises. Right now I'm going to discuss the diet. I have a lot of information regarding ADD. Now, the diet that I'm going to discuss will also help patients that are suffering from fibromyalgia and other arthritis problems as well. So it's great for either condition. So ADD is an attention deficit disorder. So maybe you can't relax your brain, you can't focus, you forget what you're doing while you're on your way to doing it. Some people have more of it than others. So you know who you are if you're suffering from this. So what we want to do is first you want to eliminate some of the toxicities that are in your diet. So we're talking about gluten, we're talking about food dyes, or yeast is something you want to eliminate, and you want to reduce your refined sugar, and those are the beginning. We want to get rid of glutenomorphins is what they're called, caseinomorphins. These are things that are in your gluten products and in your dairy products. That's the easy part. We want to relate anything that's going to contribute to leaky gut. So we want to get rid of things that are going to make your gut have that type of syndrome, leaky gut. So in order to transform your body, when you're reducing some of these things that are toxic to you, you may find that you're more symptomatic at first. It may heighten your ADD while your body's adapting to the changes. So some of the detoxes that I've done in the past have actually suggested that you gradually reduce. So maybe you're going to do a 90-day program. So maybe 30 days before your 90-day, you're going to consume less gluten and less dairy. And then by the time you get to the hard beginning, you're going to be more adapted to your changes. Okay? So when we detox, sometimes we actually get more tired because the body's not used to. We'll get something called the sugar blues. There's a whole book on it where you're so used to having sugar, you get sort of depressed when you reduce the consumption of it. We want to move away from eating a bunch of starch, and we want to move towards eating more protein. So every day you want to make sure that you're having snacks, so it's easy for you to stay on your diet. You want to have snacks you're allowed to have. So almonds, macadamia nuts, Lara bars, those are great bars that are gluten-free and they're full of good nutrition and they're GMO free. Those are a few kind bars are good. So you want to make sure that you're setting the stage for you to have a good experience with your diet. And so you want to keep it easy. You don't want to get low blood sugar and then just go ballistic and go to In-N-Out Burger. That being said, if you end up at In-N-Out Burger, you can buy your burgers protein style and you can get them without bread. So you can still consume with the rest of your family if they're not doing dairy and gluten-free with you at this time. So the nutritions that you need to add on to your diet, or it's called the nutraceuticals, will be a probiotic. You want to be at 20 million a day. I recommend is more if you can, but 20 million is a good start. I also recommend and know that there's some controversy with the probiotics. So for 90 days, you want to have a good $20 million probiotic. And then when you're extending past 90 to 6 months of a probiotic, it's nice to switch your probiotic out to make sure you're getting different probiotics. Your flora, your gut flora is always changing. And so you're staying current and having the best reaction to the probiotic. We want to have omega-3 fish oils. Flax is okay, but the research doesn't support the flax changing your omega 6 to 9 ratios as well. So we want to have omega-3. American diets, we have a bunch of omega-6, and we want to have a proper ratio between our omega-6s and our omega-9s, and it's going to give us the best outcome and our best brain function. So when we're dealing with the omegas, a child may need around 700 milligrams a day, depending on the age. So we're saying a 40-pound person. Now an adult may need anywhere, on the average, an adult needs around 1,700 milligrams a day. I have my patients take double that if they're having inflammation from their spine and their back pain. But when we're talking for wellness and ADD, around 1,000 milligrams for a younger person under 100 pounds, and then over 100 pounds, you want to be more close towards this to doubling that, and so forth. Zinc, we want to be at zinc sulfate, we want to be at 45 milligrams a day. We want to be taking a multivitamin. I've done some lectures on multivitamins. You want to make sure you're taking food-based multivitamins that are not putting fillers. Those fillers end up in your body somewhere. Fillers end up in your liver and kidney, and they can end up actually doing more harm than good. You're better off not taking any vitamins at all if you're going to take vitamins that have what we call fillers or minerals in them. So look for my YouTube video about fillers and some of the ones to look out for. Vitamin B6 supplementation and pyridoxal 5-phosphate. Those of us in the detox world have heard those words before. They might be B6 is pyridoxine, but pyridoxal 5-phosphate is just another way for us to detox our body. Okay. Magnesium. Magnesium has great benefit, and it's tolerated best when taken with B6, and we can use it topically. You can use a spray. There's lotion, and you can get this magnesium through your skin, and it's a very good way to absorb magnesium, incidentally. You can also ingest it. If you have soft stools, you may not want to take as much magnesium sulfate. You may want to do magnesium glycerate or glycinate or glycerol phosphate. There's different ways and versions of magnesium that your body will absorb but won't soften your stool. You want to be at around 2.5 milligrams per pound of body weight. So 40 pound child would need around 110 milligrams, 70 milligrams for 25 pound person. So that being said, when we use our spray bottle, it says it's like for 5 sprays, it's 240 milligrams or something of that nature, depending on what you purchase. If you're having sleep issues because of the transition or the detox, they recommend you taking some melatonin. And then vitamin D, you want to be at around 1,000 milligrams a day if you don't have a blood test on it, but the most accurate determination of how much do you need is through a blood test. But a good way to tell too is just if you feel more energy. You're getting on the right track. But if I'm having a cold, I may have as many as 50,000 milligrams in one day. I use a nice brand called Orthomolecular, and you get a high quantity of vitamin D in one pill. They recommend that you take one a week typically, but if I'm sick or if I'm going to be in the Midwest for any period of time when there's no sunshine, I may take one or extra at a given time. But typically around 1,000 milligrams a day is good. And those are some good ways to add nutrition in. So let's review what you want to do for your ADD diet. You want to eliminate your dairy. You want to eliminate your gluten. Gluten has this chemical called glyphosate in it. Typically, most products are sprayed. It's a type of pesticide that's been utilized on our soil for years, and cumulatively, it has just been devastating for our food. So that glyphosate is said to have caused our body to have toxicity and made so many of our adults and children now intolerant to glucose. So that being said, you can do a blood test to determine if you're actually glucose intolerant. But when you have ADD, you don't need to have a blood test. You can just observe your improvement on your function. So you want to get rid of the excitotoxins. So that would be dairy, sugar, food that has dye in it, yeast, and you want to move toward more whole foods. You want to make sure you're consuming foods that have protein in them. You want to make sure that you have foods around you at all times so that your blood sugar doesn't drop. You want to drink plenty of water. So typically, rule of thumb is half your body weight in ounces, unless you have some kind of disease that you're not supposed to do that, but most people need that. And then you want to add in your probiotics, your omega-3s, your zinc, your multivitamin. You want to add in your B6 and your magnesium and your vitamin D. And melatonin is added in for sleep. Incidentally, the mineral magnesium is actually really good for sleep too. I usually recommend my patients spray it on the bottom of their feet because of all the reflexology points on their feet. And then maybe put socks on if you have hardwood floors, because I don't want you slipping and falling in the middle of the night. But it's very good to help for a deep, restful sleep is when you put that magnesium on the bottom. So those are some tips for how to eat properly when you're trying to reduce your ADD. And as I said, it can also help you with your fibromyalgia type symptoms. If you have any more questions regarding nutrition and your body, I have a bachelor's in nutrition and my doctorate is in chiropractic, and I've been practicing in Arroyo Grande for almost 18 years. We are located in the Village Creek Plaza. Our number is 805-474-4747. And our website's arroyograndechiropractic.com. So if you have any questions or concerns, just give us a call or write in. Thank you.